Vision Fund meeting. I'll call roll. Or do I call roll?
I will call roll for you.
There we
Happy to
go.
do that. Committee member Stugelmeyer? Present. Schmitz?
Yes, here.
Peterson?
Here.
Thank you.
Okay, first we'll start out with item number 1, approval of the meeting minutes from our March meeting. Do I open
Move
it?
to approve.
Okay. Is there a second? Vote, is that what we do next?
Yep, I will call roll on that as well. Committee members Schmitz?
Yes.
Stugelmeyer? Yes. Peterson?
Yes.
Thank you.
Okay, item number 2 is receiving the Vision Fund financial statements. Dimitri, do you have a presentation or something today?
I do, Chair Peterson. I have the camera on here. You got it? All right. Members, Vision Committee members. So, honestly, nothing's really changed aside from the correction I had to make from last time regarding the additional project that was approved a month or two ago for the light spring. So that was added to the financials than what was done compared to what was done before. So currently we have $823,000 in projects that are being open or paid down, and then we have another $338,000 that need to be drawn down based on the approvals of the Vision Fund Committee, based on the average amount of Vision Fund loan from the city, which is about $134,000. There's about maybe 6 more projects that you can do with that dollar amount, considering they're all about there, on average $134,000. So that's what you see at the bottom there. Nothing really significant changed. Sorry about that. Nothing really significant changed from on the income statement for the year for 2025 since the last time I presented. I will say, put a caveat there that anything to do with professional consultants will be reimbursed by the sales tax fund as budgeted for by the city commission. So that is the only thing that's probably missing from this financial statement. So just to point that out. And this is the first time we've ever kind of done it like that. This is the first year of it, and so we will be doing that regularly. We just, again, it's a kind of a new process for us. So probably on a quarterly basis. So probably by next time you see it, there'll be some sort of dollar amount there to replenish the expense. This is the list of our outstanding, the detail of the notes receivable that are outstanding. On the bottom, you'll see there the 2 projects that are still waiting to be drawn on, which is a Superior Precast and Light Spring. Obviously, those haven't been drawn on yet, and ETI has withdrawn their request. So I listed that on there, but overall, that's kind of the gist of what's going on in the Vision Fund. I'll stand for any questions.
Dimitri, I'm sorry. Go ahead. Dimitri, when is the due date for the venture one? It's not shown. Or the anticipated due date?
Mayor Schmidt says on the repayment.
Yeah.
The repayment is due 7/1/2040 on the contract length. That's the repayment date.
Okay. Well, I was just looking at the area that was highlighted in yellow, and there was no date in that.
Yeah, for the start of the repayment, I don't know that we have that information yet. So at least at the time I put this together.
Okay. If we can get that, I think it would be wise, or the anticipated start date.
Yeah, I'll have to talk to my staff to see if we have the documents that we need to put that in there.
Okay. Thanks.
Yep, no problem. Any other questions?
I'm just curious on the interest rates, how are those set? I see, I mean, they're for the most part all 2%, but you see there's, the 0% in Cloverdale, and then Tide must have been 3% in there, Light Spring 1%. So
Is that says by B and D, Nathan?
So, Madam Chair, Member Stugelmeyer, typically traditionally the Vision Fund has set the rate at 2%. So there's a servicing fee that goes to Lewis and Clark Development Group that does the servicing and the underwriting on the note itself, and then the Vision Fund has traditionally charged a 1% rate. It's always flexible by this committee and by the City Commission. That's just a recommendation that we provided and that we've followed. The reasoning behind the Cloverdale one at 0% is the City of Bismarck partnered with the City of Mandan to provide the PACE buy down. We split it half and half between City of Mandan and City of Bismarck, and we followed the City of Mandan's request. They provided their funding at 0%, so the Vision Fund matched the terms and conditions of the City of Mandan's request.
Okay. Thanks, Nathan.
Do we need a motion to accept the statement, financial report?
I think if you have consensus, motion be fine.
I'll motion
So
to
moved.
approve. I'll second.
Second. Whatever.
Roll on the financial report. Committee member Stugelmeyer,
Yes.
Schmitz,
Yes.
Peterson.
Yes.
Thank you.
Okay, thank you, Dimitri. Item number 3, considering the application for Simply Golden Properties. Nathan?
Yep, thank you, Madam Chair. You have in front of you a request from Simply Golden Properties LLC for the local match of the Flex Pace program from Bank of North Dakota in the maximum amount of $100,287.20. Simply Golden Properties is the real estate holding company for the operating company that is Simply You Wellness. There's representatives from the company here that will talk a little bit about the project. I won't get into much about the project. I'll let them kind of talk that through. But essentially, the financing is for the construction of a facility at 5016 Oslo Lane in the Bowden development up along North Washington in Bismarck. This facility would essentially provide about 1.5 times the capacity that the company currently operates in, and will allow them to increase capacity in terms of overall services provided. You were provided the scoring matrix in your packet. I believe so, right? You did get that? Okay, good. And as you can see, as part of that scoring matrix, as you'll recall, we do this on all of the Flex Pace project requests. And as part of that scoring matrix, the project did score 14 out of 14. Again, just because the project scores high doesn't mean that it's an automatic yes. Just because the project scores low doesn't mean it's an automatic no. But it did score a 14 out of 14, mainly due to the average annual wages of the proposed full-time employees to be hired and the number of full-time employees projected to be hired within the first 3 years of the project. You do have in the application, you do have the proposed loan terms that I proposed, again, to Commissioner Stugelmeyer's question earlier. Those are open to whatever you all see fit. The terms that I proposed is a 2% rate, 60 months, the payment to start, no, the term is 60. Yeah, so the term of the loan will go for 60 months after the buy down is complete. You can see on the amortization schedule that was provided by Bank of North Dakota, the buy down period is set to go for 51 months. That's when the maximum buy down amount will be reached by Bank of North Dakota. So it will go for 51 months and then an additional 60 months of repayment, of P&I repayment after the buy down is complete. Something, again, that we typically leave up for discussion or for you all to decide, just a recommendation that I put in there, just a UCC security filing on Simply Golden Properties. Again, it's a real estate holding company. There's not a lot of assets outside of the mortgage that the company has, but we can certainly file that if you, or Lewis and Clark can certainly file that if you would like. And then a personal guarantee from the owner, Tara Harding. Estimated closing date of the project currently set is December of 2026. I think that should be about it. If there's any questions for me, I'm happy to answer. Otherwise, I'll turn it over to the representatives from the project to give you a little update on what's happening with the project.
Hi, committee. I'm Tara Harding. I'm the owner of Simply You Wellness. My story is kind of fun of how it started. It started in my basement in rural North Dakota. I was living and working in Ashley and went through some of my own medical experience and saw a need for change. And within my first 3 months of operation, I was licensed in 3 outside states, North Dakota, South Dakota, Minnesota. My practice quickly grew, and within the first year, I was renting space in Bismarck, driving up 1 day a week, and renting from a friend, fellow clinic owner, to do in-person and virtual outreach. About a year later, I realized I needed to be moving back to Bismarck and had a bigger calling than just being in my basement. And so within that first year, I rebranded in that time as well. But I also expanded my service. I had worked rural healthcare family practice for a decade and was able to provide full family practice for not just women. At that point, it was just fertility in women, but I was able to provide for their whole family, their neighbors, their parents, and expand my service reach as well. I did go through the Goldman Sachs program, 10K program, which was a huge pivotal moment for myself professionally, to learn and expand. I was scared to hire one person. At that point of going through it, it was just me. And I learned so much by going through that opportunity as well. I graduated from that program December of 23 and was ready to hire my first provider. January 2nd of 2024, I hired my first psychiatric mental health nurse practitioner. And within 13 months, I had 14 staff members underneath me. We had significant growth within that time. I went from the 3rd floor of Security First Bank to the 2nd floor, and I'd take up most of that 2nd floor. But we also grew our offerings at that time as well. There's a need. Every one of my providers is booked 6 or more weeks out. I have contracted workers, I have part-time staff, I have full-time staff, physician's assistants, nurse practitioners, an MD on staff as well. But it went from family practice to mental health needs. Fertility is my passion. It's my personal experience as well, women's health, but we grew to men's health, to pediatrics, hormone health. We're very innovative in our healthcare. Nobody else offers the level and type of combination of healthcare that we offer in the region. We've also grown our states to Montana, Colorado. As of last night, 63% of our patients are from outside of Bismarck. So we pull a huge part of our business from outside, and we love that because we love bringing people to here. I'm pretty active nationally as well, and have some patients as well that are from other states that I coach and bring in as well. So the application, you can see as well the number of growth. So I've grown, again, that's in 14 months. I could add a new provider every 3 months, but I have no space. This building allows me to not only expand providers, but offerings of our services. TMS therapy is a huge mental health service. We're the only provider in the region from here to Fargo offering this level of care that treats adolescents and adults. I can add more TMS therapy chairs in this new building. I can expand therapy services and other mental health services, but also fertility. There's no fertility clinics from Fargo to Billings except for here within our practice that's doing the level of fertility care that we're doing. From Fargo, there's Minneapolis. We were just talking or before the meeting, down to Denver. Most people go. I'm very connected to national providers in this space, and we have a lot of people that come to us to start their treatment because of that as well. But the job creation is something that brings me joy. I again remember when I was scared to hire one person. So when I look, my 5-year projection is 25. It makes me excited to see that. I'm in the process. I work with a business consultant. I don't do this alone. I'm in the process as we speak of hiring a operations officer and manager as well as bringing on. I have space for a nurse to bring a nurse on. I'm, like I said, completely at capacity. From an in-person standpoint. So my full-time is 9. I have 3 part-time staff. And then the projection again for 3-year is to be 13. And I honestly think I'll probably be able to reach that at a faster rate to get to 25 at the space that we're at. We did actually shift some things around already in the building. And we're going to be adding more exam rooms than we anticipated in that space. The average salary of new jobs full-time is $150,000 plus. That's because they're nurse practitioners, physicians, assistants, and then our part-time staff as well, being whether they're a provider or a nurse or assistants, that is the average part-time salary. So job creation, increased tax revenue. Like I said, 63% of our patients do come from outside of Bismarck. Boosts local job business as well. We know they're utilizing local businesses. And then, of course, improved healthcare access that is located here in Bismarck for fertility treatments, mental health therapy, TMS. Though TMS therapy, what I want to highlight that's so important about that, there's 36 treatments that those patients need. And if they're coming from out of town, they're staying overnight, they're eating here because they have to come every day, 5 days in a row for 36 treatments. And so it's a dedication, and we do have a lot of those patients currently coming from out of town. We're able to be flexible. So again, just to get real technical, if they can't make it 5 days, that's okay. They can come 2. So they're still coming and able to participate in that. So I could probably talk all day about business, but I'll close with that and open it for any questions.
Nathan mentioned a closing date. What's the estimated start date of the project?
We're hoping to dig by June. Yep.
Where exactly is this going?
Bowden Park, where Epic and Knutson is. Yep.
You hit on talking about the TMS. So when those patients, when they come to Bismarck, they'll stay here for 5 days. How about some of the other services you provide outside of that? Is it usually like are they staying 2-3 nights, or how does that typically look?
Yeah, if they're coming, they'll for sure stay 1. I've had people drive up the night before. Fertility treatment does involve overnight for sure, if not more, because those are very timed, and we usually do them in the morning, or they have to do a certain procedure the evening before, so they're having to come overnight as well. And coming back, unfortunately, if there's failure multiple times, we unfortunately see that happen a lot, where the chance of it working on the first, unfortunately, statistically is not great. So many of our patients are reoccurring and coming back more often. We do, to answer it a little bit further, we do hormone replacement therapy. A lot of our patient follow-ups, if to maybe add to that, is 3 months, 6 months. So they're coming back pretty consistently. As much as I love telemedicine, patients want in person, and we're seeing that. We're still obviously utilizing that, but they come here. They drive, they come here. Just today, I did a little math. About 90% were from out of Bismarck today, just that I saw.
Okay, thank you very much.
Yeah,
just one other question, I guess, in regards to the job creation and all that. So you said you're currently at 14 right now, and the 3-year goal is 25.
5-year goal is 25.
The 5-year goal is
yeah.
25. Okay.
Yeah, I'll squeeze as many in there as I can get in. And I'll build round 2 then if I have to.
Thank you very much.
Thank you.
If there are no other questions, you can certainly entertain a motion.
Are there any other questions?
I would move to approve as presented. This happens to be one of those projects that not only is generating some property value and wages inside the city of Bismarck, but is probably also going to increase our attraction to people who do not live in the city of Bismarck and bring in other economic benefits. To me, it's kind of one of those stories that's really good.
Is there a second?
Yeah, I'll second.
Okay, can we take a roll, please?
The motion is to approve the project as presented. Mayor Schmitz,
Yes.
Committee Member Stugelmeyer,
Yes.
Peterson,
Yes. Okay, thank you. Thank you for coming. Item number 4, considering a request for extension from Superior Precast. Nathan?
Yep, thank you, Madam Chair. You have in front of you a request from Superior Precast LLC, requesting a 6-month extension on the Vision Fund commitment. So, for those Commissioner Stugelmeyer, who's new to the committee, they were Superior Precast LLC was approved for a PACE buy down through the Bank of North Dakota on the construction of their facility down in South Bismarck, kind of to the west of South Walmart down there. This is kind of a weird one because I didn't know, I wasn't sure how you guys wanted to handle this one. They technically fell under the previous guidelines, or they were approved under the previous guidelines, which had an 18-month period to draw down funds, so they technically wouldn't have needed an extension. But with the new guidelines being 12-month, I wanted to make sure that we dotted all our I's and crossed all our T's. This is a pretty substantial construction project, complicated construction project. They just need a little bit more time with the construction. And in talking to the banker, it sounds like really the 6 months shouldn't even be needed. They figured by more than likely June or July they would be looking at advancing on it. Madam Chair, yes, they're substantially through their construction. Yep.
I'll motion to approve.
Is there a second?
Second.
Committee Member Stugelmeyer,
Yes.
Schmitz,
Yes.
Peterson,
Yes. Thank you, Nathan. I think it's nice to see what's going on when we have those gaps.
Yep. Thank you.
Okay, and item number 4, any other business?
maybe just for the applicant, it would be our intentions to forward this project to the city commission meeting for the first meeting in May. And I'm just pulling up the calendar. That would be Tuesday, May 13th, that we would see this on the city commission agenda.
Jason, on the extension, do we need to, that probably needs to go to the city commission as well.
Yes, Mayor, we would add that to the same agenda and do it as a consent agenda item,
Yes,
if that's acceptable. Okay,
that's acceptable, not the other one, not the application though. I
correct.
think
That would
deserves
deserve
the discussion.
absolutely on the regular agenda for the current project today. Thank you.
Is there any? Thanks, everybody.
Thanks, Mayor.